health. That accounts for why we have this program on television, just so that you can remain healthy always. And today, we take a look at the fact that it is World Tuberculosis Day. To that extent, we have a resource person in the studio to dwell on it. That is Dr. Fatima Adamu, Department of Community Medicine, Aminu Kano Teaching Hospital. Doctor, you're welcome.
Thank you.
Now, I want to use as term to kill two birds. By that, I mean I want to ask two questions at a go.
Okay.
Today is World Tuberculosis Day.
Exactly.
Just before you tell us the significance of this World Tuberculosis Day, could you let us know what tuberculosis itself means?
Because Mycobacterium tuberculosis, and it is transmitted through air droplet. It is transmitted when a person that is infected with the disease cough, sneezes, or even speaks, and the droplet is released into the air. So this tuberculosis it's a devastating disease. It's one of the most deadly disease, and it's said to be second.
Even though it's deadly,
but it's curable.
And preventable.
And it's preventable.
Now, we have types of tuberculosis.
Yes, we have the pulmonary tuberculosis,
which is the significance of World Tuberculosis Day.
Okay, the significance of World Tuberculosis Day can never be overemphasized because it raises awareness about the disease. Yeah, the consequences of the disease, the health consequences, the financial and economic losses is if we have the disease, where should we go for the treatment? And the disease is curable, the drugs are free, and then if we don't have the disease, how can we prevent ourselves from contracting this disease? Yeah. So all these are part of significance of World Tuberculosis Day. And since the discovery of the bacteria causing this tuberculosis, the day has been commemorated all from that 1882 up to date, 24th March of every year.
Now that brings me to this question. You have talked about consequences. Dr.
Robert Koch, yeah.
Good. Who of course discovered all of this way back in 1882.
Yes.
From that time to this time, we have been celebrating World Tuberculosis Day.
Yes.
Now, I'd like to ask this. From that time to this, progress has been made in a way of trying to reduce the spread of tuberculosis.
Yeah, exactly. Because global effort to combat this tuberculosis have saved tuberculosis. So I think it's
say that the coming of COVID-19 still allowed it to maintain that progress?
No, because with the emergence of COVID-19, majority of the resources, when we majority of the countries tailored their resources program, it's now suffering. Yeah. And again, during the era of this COVID-19, the patients or people have difficulty in accessing health service following this awareness.
A kind of reversal.
Yeah, exactly.
See. Okay. Now,
cough is usually productive, which can be blood stain or might not even be there might not be even blood in it, but it's usually productive of sputum. And apart from that, the patient might complain of fever with chills, and he can also complain of excessive weight loss. He can also complain of drenching night sweat. He will be feeling very hot. He will be sweating. Maybe even if it's an AC or maybe it's a cold weather, he will be just sweating. Depending on where the bacteria is affecting. For example, for those with abdominal tuberculosis, they might come up with abdominal pain, abdominal swelling, and some that it also affects other parts of the even inability to work when it affects the spine. So it depends on where the TB affects. So the symptoms is based on the type of tuberculosis you have. Yes. But once you have the symptoms, you should quickly come to the hospital to seek for medical care.
Yes, you've mentioned pulmonary
and extrapulmonary.
The extrapulmonary has to do with the other parts
of the body, yes. But the pulmonary tuberculosis is the commonest type of tuberculosis.
Like the coughing, chest pain, fever.
Exactly.
Sweating. World Tuberculosis Day. I just like to be mentioning it over and over, just so that anyone that is listening will get to know what we are doing at this moment. Also, as you can watch us on Night Concert as well as our Facebook platform. Now,
tuberculosis during towards TB diagnosis, treatment, as well as care, and also it also encourage provision of essential tuberculosis services, and which should be sustainable, and in order to fight this tuberculosis, and also tackling the inequalities we are seeing in order to ensure health for all. Yes.
Okay. There are invests
to end towards COVID-19 pandemic response. So that's the reason for the team.
Okay.
Invest to end tuberculosis, and also once you invest in a tuberculosis program, then many lives will be saved. So that's the thing. Invest to end tuberculosis and then save lives. Exactly.
Less attention was paid to different other
health issues. Exactly.
And so now it is important to pay attention to all these various health challenges.
Exactly.
Tuberculosis happens to be
to end tuberculosis and then save lives.
Can you about these two? We only make reference to the respiratory tract system. So I want to know how they are related, sort of.
Okay.
Because I could recall that when looking for hospitals to take care of those with COVID-19, it was pretty difficult at the beginning. You could talk about Motivo Hospital in Edo State. You could talk about the one in Lagos State. I think it was later you had some in Abuja, but that of Lagos, I'm quite aware of that. They did mention that there was some equipment used for tuberculosis, which perhaps were converted. So that is why I'm trying to know what relationship two of them have, COVID-19 and tuberculosis.
Can also have cough in tuberculosis. The patient can also have fever. So you can't say this signs and symptoms are specifically to either COVID or they are specifically to COVID-19. So that's the reason. Once the patient comes to you, you need to take that detailed history, do a general examination or physical examination, and then coupled with your clinical acumen, with the investigation you give, that's only when you're going to say the patient either has COVID or he has tuberculosis.
I can imagine pandemic came, because you were dealing with something like tuberculosis and all others. All of a sudden, something else just came, and so for sure it was going to be pretty difficult to get to know what was wrong with anybody. So I can imagine what you people went through in trying to get distinction between COVID-19, tuberculosis, and all other health conditions.
Yes, we can't help it because we are serving humanity.
And we would like to praise your effort, because I just wonder what we would have done when we talk about our health if not for you people trained to take care of us. And then you were at the forefront. You never bothered about what the outcome would be. So we commend your effort.
Thank you.
Yeah. Now, I'd equally like to know, since we are commemorating this day, Tuberculosis Day, whether there are certain activities lined up, maybe like people coming for, perhaps, apart from what you're doing right now, that's the public awareness, the enlightenment, whether there are certain things, maybe somebody coming for. Okay.
So anytime you walk into a hospital, the screening for tuberculosis is free. The medications for tuberculosis is free. So you can see how the beauty of
because people may not know.
Some people may not know, so they will think maybe if they go to hospital, investigations or maybe for drugs, but they are all free. So you just only need the patient to come.
Yes.
That's all we need from you. That's all we need from the patient. Once you are experiencing this signs and these symptoms, you should quickly come to a healthcare provider so that he can take a history, examine you, and tells you what it's really wrong with you.
Yeah.
If it's tuberculosis.
So how do you react to this, doctor? To date, your wife might just even react. Your children may even do the same. Maybe you have cough, and then the cough appears to be breaking. Cough can break, particularly the one that has been in the person for a while. It begins to soften. When it's getting softened, you just do something like this, and you hear something, a very, very noisy sound and embarrassing sound.
Okay.
And then the next thing you hear, TB. Cases that it has to be so, it has to be TB.
I think it's because of the awareness. So people now really understands that this disease is real. But even if it's real, they know they can easily get cured. So that's the reason they usually raised suspicion about this disease, either COVID-19 or tuberculosis. Even though it might not be that, maybe it can be just a simple respiratory tract infection. So I think it's because of the awareness. People now are becoming to understand what tuberculosis is, how it can be prevented, and it's curable. So there is nothing to panic about.
Yeah.
Unlike before, we don't have a cure for tuberculosis, but now we have a cure for tuberculosis. So once you are diagnosed with tuberculosis, it's not a death sentence.
Welcome back. The program is Health Hour on Ranar Television, and I am here with Dr. Fatima Adamu, department maybe are the ones that get affected.
Yes, one of the risk factors is age, extreme of ages.
No, it's not the. I think we'll get to the risk
factors. Okay.
You know, age, yes, can be one of the risk factors. All right,
okay.
But then we have.
That's the reason I say. Of course, they are affected. That's the reason I say extreme of ages. As you age, I said age.
Okay.
Then apart from that, people that are coming into area that have high prevalence or high rate of tuberculosis and they are not immunized are at risk of contacting the disease. Likewise, the IDP in this disease. So those are some certain people that have high risks of having this disease. Also, people that are placed on some certain medications, for example, corticosteroids, which also suppress the immunity. So they are also at risk of developing tuberculosis, because since the immunity is suppressed, the body cannot, or can, let's say the immunity has been weakened. So the body will not or cannot handle this tuberculosis.
Yes, because the immune system is
down. So that's the reason they are at risk of developing the disease. So these are some of the people.
Yes, okay. But you know, as we get into that, perhaps we mention some other risk factors. I know you've mentioned the issue of age.
Yes.
Those who live in crowded places, right? When we talk about that, then we look at the refugees.
Yes.
We have much of that in our country today. And if you talk about Ukraine right now, you know, you have some people that can give room for tuberculosis.
Exactly.
Then again, you mentioned the issue of
risk of contacting the disease, and also children that were not immunized, and close contacts with a patient that is infected with tuberculosis. As I said earlier, overcrowding, living in a space where there is no much ventilation, so there will be concentration of that droplet. Since I said since tuberculosis is spread, it's an air.
I feel for them. You know, it's not well ventilated.
Yes.
And when you talk about the correctional system here, there's a prison system in our country. Oh my goodness, the place is so hot. You know, if you go there to visit for a visit, maybe you went there to pray for them and all that. That's when you get to know what they go through. The kind of hot air that comes out from there. You can imagine people are inside, you outside, you're feeling the heat is kind of.
Indoors. You get it? Not only because of tuberculosis, even because of other health-related issues.
Some infections and contagious diseases.
Exactly.
Yeah. Because when we were in the heat or in the heart of this COVID-19 pandemic, they kept telling us maintain social
distances. Exactly.
So I just wonder how much they were really maintaining it would have been very, very terrible. It's not as if it didn't enter, but God stood for everyone. Okay, now, doctor, you have mentioned the fact that
usually send them to can commence the treatment, and for pulmonary tuberculosis, we give the treatment for the course of 6 months. And while for extrapulmonary, it's for almost a year. And still, not that you're just going to be given the drugs. We ensure that the patient take the drugs. Though it's a very difficult task to say that we are going to ensure each and everyone takes his of that particular person. He will